You and your partner are sitting in a fertility clinic after trying for months to fall pregnant. You're desperate to finally start your family, but nothing seems to be working and all you want are answers for why. Your doctor has suggested that it may be because of blocked uterine tubes, but the only way to know for sure is a hysterosalpingogram, HSG. What on earth is that? Well, a HSG is a fluoroscopic examination where X-rays are used to show the filling of the uterus and fallopian tubes with iodinated contrast media. Filling defects within the organ gives us evidence for tubal occlusion or other structural abnormalities that may be contributing to your infertility. But all you see are pamphlets around you talking about the risk of radiation exposure, the risk that it could pose to a potential fetus, the further risk of an anaphylactic reaction to iodinated contrast media. You've never had the contrast before. Could you be allergic? As you look down at your consent form, you realise that you have to sign off on both of these things in order to have your HSG and get your answers today. You can see how this might be a little bit daunting. But as it stands, HSG is the most common procedure used to assess the patency of uterine tubes in females with suspected infertility. We know that the procedure has high diagnostic accuracy and is much less invasive than laparoscopy. And with 40% of female infertility cases being due to tubal obstruction, the information that is provided by this examination is invaluable in determining whether patients are needing to consider other options such as IVF. So we accept the risks posed by radiation exposure and iodinated contrast media because there aren't any other examinations that can be used instead. But aren't there? Well, I put to you sonosalpingography, able to be performed in a doctor's office with ionizing radiation and iodinated contrast media put aside in favour of ultrasound and saline. It sounds much better already, doesn't it? My research is looking to determine whether SSG would indeed make a suitable replacement for HSG in the evaluation of uterine tubal patency in Australian fertility clinics, to be able to reassure patients that in their fertility journey, the procedures that they undergo will not pose a risk to their health or their future child's. As part of this investigation, I will be analysing the diagnostic accuracy of SSG, as well as comparing the risk factors, post-procedural complications, and patient comfort levels with that of HSG in order to determine where the disparities are. With tubal factor infertility being such a common occurrence amongst those working towards a family, a review of our standard practices with infertility workups will ensure that the safety and comfort of patients undergoing these investigations remains at the forefront of our clinical practice.